It's likely that you are taking other prescription drugs if you have a thyroid condition. How do I know? Because thyroid problems increase your risk of developing problems like high blood pressure, high cholesterol, and weight gain. Did you know that the medications used to treat these issues can actually make your thyroid worse? It's true that there is a vicious cycle where you may be taking medications to treat your thyroid issue, which can then cause your thyroid to worsen again. Today, we'll go over this list of medications to make sure you aren't taking any other medications, and what to do if you are. Prescription drugs can affect thyroid function in four main ways, and when I use the term thyroid function, I mean how well your thyroid is functioning, because these side effects can vary from minor to severe. Many of them may actually go unnoticed. To help you grasp what I mean, let's review these four categories. The first group includes drugs that affect the conversion of T4 to T3, which is the process by which your body transforms the dormant T4 thyroid hormone into the active T3 thyroid hormone. Since T3 is the most potent thyroid hormone available, you will begin to experience low thyroid symptoms such as weight gain, hair loss, and depression if your body is unable to do this, or if its capacity to do so is even slightly compromised. More surprisingly, a number of medications, including some that are used to treat common conditions like depression and high blood pressure, can cause this very problem, which results in low T3. First on this list are drugs that belong to the beta blocker class, which is used to treat diseases including anxiety, headaches, and high blood pressure because hypothyroidism causes high blood pressure. The good news is that there are many other blood pressure lowering medications available, and switching to one of them is actually fairly easy. However, if you want to do something even better, I would advise you to focus on lifestyle changes because doing so can not only improve your thyroid, but also lower your blood pressure. It is very common for patients with this exact issue to be taking these very medications, so if you are, make sure you check with your doctor to see if you are taking a beta blocker because it may be making your thyroid function worse. Narcotics are the next class of prescription drugs that do this. This includes all forms of moderately potent narcotics, like Vicodin and Percocet, and even stronger ones. What's more worrisome, though, is that low thyroid function can cause fibromyalgia and chronic muscle pain. So you might be taking painkillers to treat pain that is actually related to your thyroid, which will only make your thyroid condition worse. Though I understand it may sound confusing, I have personally witnessed it occur. It's also important to note that some patients, particularly those with Hashimoto thyroiditis, take low-dose naltrexone, a medicine that may suppress narcotic function. Keep all of this in mind if you are taking that medication. Additionally, some over-the-counter pain relievers, such as ibuprofen, can also negatively affect your thyroid. If you must choose between narcotics and over-the-counter versions, go with the latter. Next on the list are antidepressants, and this one is really important because how many of you reading this right now are taking an antidepressant to treat depression and were unaware that it could worsen your thyroid? Approximately 24% of American women take antidepressants, and since hypothyroidism causes depression, this figure is significantly greater among hypothyroid patients. Optimizing your T3 level is the best strategy to treat depression if you have a thyroid issue. This is precisely why T3-only drugs like Cytomel and liothyronine can have an antidepressant impact. Depression is not a prerequisite for this effect. It's that your thyroid is not receiving enough treatment. The next two drugs on the list are PTU and methimazole, both of which are antithyroid drugs used to treat hyperthyroidism. It should come as no surprise that these drugs cause thyroid function to decline, as that is precisely what their users want. The issue here is that some of these people are actually taking more than they need since they have too much thyroid in their bodies, which can cause them to go from a hyperthyroid state to a hypothyroid state. The second group of drugs we must talk about are those that prevent the creation of TS. They function by obstructing the communication between your brain and thyroid gland. Although there are many thyroid patients with thyroid issues, the most of them only concentrate on their thyroid gland, which is located in their neck, as it is where the majority of thyroid issues occur. Because of their brain and pituitary gland, not necessarily their thyroid gland. If your brain is unable to communicate with your thyroid gland, it doesn't matter if it functions. Otherwise, it won't receive the signal to produce thyroid hormones. This is a significant and frequently disregarded cause of thyroid issues, and there are numerous medications that can exacerbate the problem. The first item on this list is steroids, which are drugs that are frequently administered to patients with high body inflammation levels. Most doctors are aware that these potent drugs should not be prescribed for an extended period of time, but occasionally it might be required. These steroids have a suppressive effect on TSH in the pituitary gland, and the longer you take them, the worse this effect gets. By the way, topical steroids can also have this side effect, which is particularly true if you apply them to areas of your face with thin skin. In some cases, you can even apply enough steroid cream to your face for the steroid to enter your body and cause problems with your thyroid and adrenal glands. Next on the list are dopamine agonists, which are rarely given drugs used to treat Parkinson's disease. However, for the sake of completeness, I did want to include them here. Lastly, we have one of the most widely prescribed drugs, metformin, which is often used to treat diabetes and insulin resistance, but is also used off-label to treat conditions like obesity and longevity. What's truly intriguing about metformin is that, contrary to what was previously believed, it may really have a positive effect on TS rather than a negative one. In other words, using metformin may potentially increase thyroid function. A big thank you to those of you who stuck with us this far. Creating these videos takes significant effort and dedication, so if you're enjoying the content, please hit the like button, subscribe to our channel, and share your thoughts in the comments. Your support truly helps us grow. Now, let's get back to the video. After reviewing this data, I believe that this is most likely the case and that it would be worth taking into consideration, particularly if you have Hashimoto's thyroiditis and require a thyroid function boost. However, I am including it here because some of it is currently up in the air. Medications in Category 3 prevent the thyroid gland from producing thyroid hormones. Though this category is slightly different, the drugs we've covered thus far have the potential to affect both thyroid conversion and your body's capacity to create thyroid hormone from the thyroid gland. Although these drugs are less common than some of the others we've covered so far, you should be aware of them nonetheless because they function by directly harming the thyroid gland, which is more like what Hashimoto thyroiditis does to its victims. If your thyroid gland isn't functioning, it doesn't matter if your brain is communicating effectively or if your body can activate that thyroid hormone. First on the list is potassium iodide, a type of iodine used in dermatological operations and for skin cleansing. Unless you have these procedures done often, it is unlikely to give you any significant problems. However, you should be aware that excessive iodine intake may affect your thyroid's capacity to make thyroid hormone. Lithium is another drug in this class. This one is more popular because it treats both bipolar disorder and mood disorders. The issue is that excessive lithium use, particularly over an extended period of time, can permanently damage the thyroid gland, so anyone taking lithium needs to have their thyroid checked frequently. It's important to note that T3-only thyroid medications, such as Cytomel and liothyronine, have been proven to be very effective at treating bipolar disorder. Therefore, it would be worthwhile to investigate these treatments if you are taking lithium for bipolar disorder and haven't already. The third drug on the list is amiodarone, a cardiac medication that isn't very common and whose prescribers are aware that they must monitor thyroid function while a patient is taking it. Since practically all prescription drugs have the potential to affect thyroid medication absorption. Category number 4, prescription drugs that prevent the absorption of thyroid medications, is arguably the largest of all the topics we have covered thus far. While it is true that some medications cause more serious problems with absorption than others, you should be aware of the fact that if taken improperly, this is the reason you have been told to take your thyroid medication on an empty stomach if you have been prescribed it. Antacids and acid blockers are at the top of this list. The most dangerous thing about these drugs is that they are sold over the counter, which leads to some people becoming addicted to them and taking them for years on end. Basically, any drug that lowers stomach acid will affect the absorption of thyroid hormone medications, and that's because your body requires acid to break down nutrients and even thyroid medications to absorb them. Unfortunately, these medications often suppress acid production for hours after you take them. Even if you take your thyroid medication hours away from them, they can still cause problems. Therefore, the best way to deal with this problem is to try your best to stop taking those acid blockers. Fiber comes next on the list. Constipation is another adverse effect of hypothyroidism that is frequently treated with fiber supplements and medicines. And by the way, have you noticed the connection here? A lot of thyroid patients take various prescription drugs to alleviate the symptoms of thyroid dysfunction. But many of these drugs wind up making their thyroid issues worse. For a moment, these fibers help to relieve the symptoms of constipation by pushing stool through your GI tract, but they also speed up the rate at which your thyroid medication passes through your GI tract and may decrease its absorption. The true focus and message I want you to take away is that optimizing thyroid hormones, not taking more medication, is what's needed. Additionally, this holds true for the fiber in your diet as well as the fiber in weight loss supplements like glucomannan. Orlistat, a drug that prevents the absorption of fat, is the third item on the list. Next up is cholesteremin, which is frequently used to treat high cholesterol and is regarded as a binder due to its binding capacity. It is also occasionally used to treat diarrhea and even as a detoxification agent. Although it isn't as widely used as some of the GLP-1 agonists these days, some people still use it. Calcium carbonate is the next item on the list. It is used to replenish the body's low calcium levels and is frequently prescribed to patients who have had their thyroid glands removed and have also experienced damage to their parathyroid glands. If you are taking any kind of calcium, including calcium from your diet, you should take your thyroid medication at least 4 hours apart from it. The next drug is ferrous sulfate, which is just iron and is frequently used to treat anemia and low iron levels. Similar to calcium, iron is a potent thyroid hormone binder. The last item on this list is estrogen, or any product that raises estrogen levels. And like calcium, it should be taken 4 hours before taking any thyroid medicine. Although estrogen doesn't directly affect the absorption of thyroid medications, it does affect how well your body uses them, because it raises the levels of a protein called thyroid-binding globulin, which binds to free thyroid hormone. If your levels of thyroid-binding globulin rise, your body will have less free thyroid hormone available for use, which isn't always a bad thing, but you should be aware that if you are taking anything that raises estrogen, you might need to adjust the dosage of your thyroid medications. The story's lesson is to double-check your prescription medication regimen if you are taking thyroid medicine in addition to any other prescriptions. You should also be aware that many of the medications you may be taking are intended to treat the symptoms of hypothyroidism. If you discover that you are taking a prescription drug that I just covered, your next course of action should be to speak with your doctor about possible substitutes. For example, if you are currently taking a beta blocker for high blood pressure, you might want to switch to an ACE inhibitor. The same reasoning applies if you're taking an antidepressant, painkiller, or anything else. Making minor adjustments to your medications can improve your thyroid function by 10 to 20%, which can have a significant impact on your mood. However, I can offer you even better advice. If you concentrate on improving thyroid function, you may notice that many of your symptoms, such as high blood pressure, high cholesterol, hair loss, and weight gain, completely go away. Try lifestyle changes before turning to prescription medications. Instead, It just so happens that your thyroid responds very well to these treatments, which include regular whole foods eating, exercise, stress reduction, and even taking particular supplements. In conclusion, understanding the impact of certain prescription medications on your thyroid health is crucial for maintaining overall well-being. As we've discussed, various ARCS medications, including some antidepressants, steroids, and specific cancer treatments, can adversely affect thyroid function, leading to potential complications such as hypothyroidism or hyperthyroidism. It's essential to stay informed about the medications you take and to communicate openly with your healthcare provider about any concerns you might have regarding your thyroid health. Always consult with your doctor before making any changes to your medication regimen, as they can provide personalized advice based on your unique health needs. If you found this information helpful, please take a moment to like this video, as your support helps us reach more people who may benefit from these insights. Sharing this video with friends and family can also spread awareness about the importance of monitoring thyroid health and understanding how medications can impact it. Don't forget to subscribe to our channel, Health Angel Solutions, for more informative content on health and wellness. We're committed to bringing you the latest research, tips, and advice to help you live a healthier life. Your health journey is important to us, and we're here to guide you every step of the way. Thank you for watching, and remember to prioritize your health. Knowledge is power, and together, we can make informed choices for a brighter, healthier future.